What I'd like to do in the next 30 minutes is first of all try to impress upon you the growing urgency of this crisis. In many ways, I think the growing cost of our healthcare system is probably the single most pressing domestic challenge facing our nation today, even for those who have good health insurance. And it's not just because of the growing number of people who lack timely access to needed medical care, but also because of the implications of spending an ever-growing portion of our resources on this one sector alone. A lot of people don't appreciate the fact that since 2003, the cost of Medicaid has begun to exceed the cost of primary and secondary education as the largest item in most state budgets. One of the things, the conclusions that I came to in my experience with the Oregon Health Plan, from its inception to its ultimate sort of unraveling, was that at the end of the day, this is not a state problem and it's not a Medicaid problem. It's a national problem and a system problem, and you cannot fix it at the state level unless you can change the fundamental structure with which state efforts have to take place. So to do that, to get Congress to act, there are 3 steps that are required. First, you need to be able to describe a vision of what the new healthcare system ought to look like. And I'll come back to that because that is the heart of the Archimedes movement. The Roman senator Seneca once said that no wind is the right wind if you don't know what port you're sailing for. So you have to agree on where you want to go. Secondly, we need a way to expose the contradictions and inequities in the current system, those things we just talked about in the Healthcare Equity and Empowerment Act that no one would support if they stand up and endorse. And third, you have to create a tension between your vision and the status quo. Now, if you think about it, the Oregon Health Plan 15 years ago is a real-life example of the power of that approach. Between 1989 and 1992, this little state that had less than 3 million people at the time became the focal point of the national health policy debate. Now, why was that? Why wasn't it California or New York or Pennsylvania? It's because we passed a bill that was illegal. We basically said, look, we're not going to be constrained by the existing structure of Medicaid. It doesn't make any sense. It made sense in 1965, but this is 1989. So we gave our permission to say, look, if anything were possible, how would we rewrite it in a way that makes sense for Oregon? And we did. And we passed it, even though we knew we couldn't implement it without waivers from the Congress. But by seeking these waivers, we forced Congress to compare the existing Medicaid program against a more rational way to provide services to low-income citizens in this case. And it maximized the pressure for change, and that's how we got the Oregon Health Plan. A lot of people don't remember that in the first presidential debate in 1992 between Clinton and President Bush and Ross Perot, they asked a question about the Oregon Health Plan waiver. That's at the point that candidate Clinton said, yes, I'd give them the waiver if I was elected president. We managed to drive the debate into the presidential election. I believe that only by creating this kind of pressure can we force the kind of debate we have to have into the United States Congress in time for us to actually change our course. But it has to be undertaken on a much broader scale. The Archimedes movement essentially is dedicated to trying to create a process where we can say to ourselves, look, if anything were possible, how would we take the public resources that we're currently spending on healthcare in Oregon today and reorganize those in a way that would ensure universal access to an effective set of health services that maximizes the health of the population. Today, there's about $6.3 billion that we spend every year in Oregon on health care. If you add up Medicare, Medicaid, and the foregone general fund revenue deductibility definition of employer-sponsored coverage, it's $6.3 billion for 3.6 million people. What would happen if we got together and figured out what that would look like? We'll talk about that a little bit more. I want to wrap up here, first of all, by saying that I'm not suggesting to you that this process that I hope you'll get engaged in will in any way eliminate the stakeholder politics that have created gridlock in our nation's capital, and to some extent in Salem. They'll still be present. But I believe they're more manageable at the state level, and I believe in the bottom of my heart that we still have the capacity in this state to have a conversation among ourselves that is no longer possible inside the Beltway. In any event, it gives us an opportunity to start leading instead of simply reacting. William Jennings Bryan once said that destiny is not a matter of chance, it's a matter of choice. It's not a thing to be waited for, it's a thing to be achieved. And that's what I want to leave you with this afternoon. Whether we are just going to sit here and let the future happen to us, let these huge changes come in over the transom and shape our future for us, or whether we're going to try to step up and shape that future with our own hands. The question is whether we still have the will and the capacity in Oregon to come together as a community. Because if the people themselves are unable or unwilling to agree on what we want this healthcare system to look like, then the political process cannot and will not do it for us. And we are destined to continue to be shackled in these failed policies of the past. And by default, we'll be allowing our future to become a matter of chance rather than a matter of choice. And I think we better plant the seeds of tomorrow to change the world by acting and by leading and by re-engaging personally in this debate, not as captives or victims of the status quo, but as the architects of a new future. We can do that here in Oregon, but only if you're willing to do it together. Thank you very much.